Hello class, my name is Natasha Maya and I will be discussing diabetes. What is diabetes? Diabetes is a disease in which the body's ability to produce or respond to insulin is impaired. It is a lifelong disease that needs proper management for a quality life. Kranish and Mann identified 3 types of diabetes. Type 1 diabetes involves insufficient insulin production. Type 2 diabetes involves inappropriate response to diabetes, and gestational diabetes, which occurs only during pregnancy. Type 1 diabetes is common in children and adolescents, while type 2 diabetes is common in adults. Type 2 diabetes accounts for at least 90% of all diabetes cases. According to Clark and Ford, the global prevalence of diabetes will surpass 250 million people in 2025. Diabetes is and continues to remain a serious public health challenge. In addressing the problem of diabetes, the right approach is necessary. The biopsychosocial model takes into consideration various elements that affect people's health to promote positive outcomes. The biopsychosocial model. The biopsychosocial model integrates posits that diseases are caused by biological, psychological, and social factors which also affect the treatment outcomes. Biological factors are related to the functioning of the body with respect to cells, tissues, organs, and systems. Psychological factors include emotions, behaviors, and thoughts. The social components focus on socioeconomic status, poverty, culture, religion, technology, and their influence on health. The biopsychosocial model was developed by psychiatrist George L. Engel. And here's a table of the biopsychosocial model of disease. The biopsychosocial model of disease. Biological factors are perceived as the main factors in health. Biological factors include infectious agents, toxins in the environment, genes, physiological reactivity, and immune responses. Psychological factors are concerned with the behaviors, emotions, and thinking patterns of a person. For example, these factors include stress, coping ability, personality, health-related habits, and reactions to illnesses. Finally, social factors are also major determinants of health. They include level of education, income, culture and religion, sanitation, insurance, and social support, among others. And here's a table of the biopsychosocial factors in health. The causes of diabetes. Diabetes originates from biological, psychological, and social factors. These factors lead to the development and maintenance of the disease. Each of these factors should be taken into account when diagnosing and treating diabetes. Biological causes of diabetes. Biological causes relate to the functioning of the body. Biological factors cause diabetes when abnormal functioning of cells, tissues, organs, or systems predispose a person to the disease. They tend to be the main focus when managing diabetes in patients. Biological causes include autoimmune disease, insulin resistance, genetics, obesity and/or overweight, rare infections of the pancreas, and polycystic ovary syndrome. Psychological causes of diabetes. Stress. Stress hormones such as cortisol raise glucose levels in the blood. Stress also causes the liver to release more glucose into the blood. Stress also increases incidence of type 2 diabetes, and it's been occurring over 35 years. As said by Novak, eating disorders include anorexia nervosa and bulimia. Social isolation. Social isolation contributes to loneliness and stress. Social causes of diabetes. Social factors include complex elements in the physical and social environment. Social factors are increasingly recognized for their relationship with type 2 diabetes and the role in treating the same disease. In general, social factors are primary influencers, and best predictors of health. Examples of social factors associated with diabetes include income levels, level of education. Educated people are less likely to develop diabetes because they are informed and make right lifestyle choices, as said by Clark Sanutz. Access to healthy and nutritious foods, access to care, built environment and infrastructure, include infrastructure to promote physical activity, social and community support. Treatment of diabetes. The use of biopsychosocial model is more appropriate in treatment of diabetes. Biopsychosocial treatment approach involves a consideration of all factors that cause the disease and impact treatment outcomes. Understanding the development of diabetes and the disease goes beyond signs and manifestations. It also involves various causes stemming from biological, psychological, and social elements. Treatment of diabetes. Like mentioned before, diabetes is a lifelong condition. It has no cure but can be managed to ensure patients live quality life. Goal of type 2 diabetes is euglycemia and prevention of complications, and the method of managing diabetes involve the following. A patient must eat a nutritional meal or nutritional meals, exercise, monitoring their glucose, pharmacologic, and education. The biological treatment of diabetes. The biological treatment involves meds or surgery. An example of potential treatments include oral medication of insulin, pancreas transplant, islet cell transplant, laboratory assessment, and self-monitoring of blood glucose. Biological treatments are often affected by levels of income. Social treatment of diabetes. Social treatment involves addressing social conditions that predispose one to the disease. Studies have shown that social factors lead to disproportionate development of chronic conditions. Social treatments may include, but are not limited to, the following. Diet, which aims at maintaining near normal blood glucose levels, avoiding habits that increase risk of diabetes, for example, alcoholism and smoking, and exercise, which ensures normal blood sugar levels, especially for diabetics with high blood sugar levels. Exercise increases uptake of glucose by muscles and improves utilization, alters lipid levels, and increases HDL and decreases TG and TC. Patients on insulin should check sugars 2 to 4 times per day. Not on insulin should check themselves 2 to 3 times per week, according to the book and the resources during this research. Should check before meals and 2 hours after meals. Parameters from physician are very important. And that concludes my presentation on diabetes. Thank you very much.